Hello, hello everyone. Hello. I hope you all are doing okay today. I'm going to just adjust my volume. I'm sitting outside and there's some rain behind me, so I just wanted to make sure you guys can hear me. Welcome, welcome. If you're signing in, go ahead, please, and type your name for me in the chat or just wave a wave. I'd love to know who's here so that I can welcome you personally. Thank you for being here today. I'm not going to take too much of your time today. I know many of us are still trying to enjoy as much as possible the holiday that we are enjoying from this week. And, I know it's looking very different this year. And so, I want to be mindful of that. Many of us have been online, some of us have had small gatherings. And so today, I know definitely from many family members, I've had a lot of questions come up about what we currently know about COVID vaccines. So I'm just going to give us a very quick update in terms of what we know. Hi, Terry. Thanks so much for being here. I appreciate you being here. Thank you. So I'm just going to give us another few seconds and then we will get started. Terry, can you hear me okay? I know there's some rain in the background. Can you hear me okay? I hope you guys had a wonderful holiday there in South Carolina. Good afternoon. Good afternoon. Thanks for everyone who is here. As you come onto our Sunday chat this week, please just give me a little hand wave or type your name into the chat box for me. That way I can welcome you. Okay, thanks, Terry. Thank you for letting me know that you can hear me okay. Thank you so much. Hey, Val, thanks for being here. Okay, welcome, welcome, welcome to today's Sunday chat. So let's go ahead and get started, guys. Oh, hey, Joan, how are you? Thank you for being here. I appreciate you. Thank you. All right, well, guys, let's go ahead and get started. I promised I wouldn't take too much of your time, but I thought this was important because as we're learning a lot and seeing a lot of what's going on with COVID-19 vaccines, I have more questions that are coming from, patients, from family members. So I thought this would be a good time to just come on and give a quick update about what we know. Now, granted, there's still a lot that we don't know, but I figure we can just continue having these updates as we know more. I'm happy to share more, and we'll go that way. Okay. Hey, Joan. Yes, thank you for being here. So, so let's go ahead and get started. So I'm Dr. Madeline, your board certified OBGYN, former CDC epidemiologist, international speaker, and published author. I help women access tailored GYN care and birth control that they need so that they can have the most freedom and control possible and they can live their best lives. And so when I come on and do these chats, is to make sure that as many people as possible have as much information as they need so that they can make the best decisions that they need to make for their health. Okay, so that is some background about what we've been doing in these Sunday chats. So let's go ahead and get started because this is this is a topic that's been on the news and it changes all the time. Whenever I hear something new, I can certainly share with y'all that my learning curve with this is steep, like it is for many people. We're all experiencing this for the first time. I can tell you that I've shifted a little. Maybe a month ago, I was in the space of I would probably not take a vaccine too early on because I didn't necessarily feel as comfortable with the information or lack of information thereof that was coming out. But as we have more actual scientific data coming out, as we are hearing more from different companies about the variety of their approaches, I'm beginning to evolve with my thinking. I'm not, maybe I won't be the first one in the line, but I'm certainly more willing to listen and hear what's going on. Okay, welcome anyone who comes in. Please feel free. Hey, Lee, thank you for joining us. Thank you so much. Welcome. So let's just talk. I just want to kind of briefly talk about the three companies, the kind of the front runners that we know are out there these days. And a lot of this stuff is being covered and the media. I know some folks don't watch the media, so I figured this would be a good chance for us to just kind of briefly go over what's going on. So the first thing to know is that there are three companies right now that are front runners. Pfizer has a vaccine, Moderna, and also AstraZeneca. That's also been called the Oxford vaccine. So those are kind of the vaccines that we're kind of looking at these days. That if they're going to be ready, when you hear people saying, "Oh, it looks like something might be ready in December or ready in early January," it's any of those three companies that folks are talking about. Okay. Now, what's important to keep in mind is that most of the vaccines that we're used to hearing about, the vaccines that we get from our doctor's offices, most of those vaccines have already gone through a full FDA review and approval process. Now, FDA review and approval usually is something that takes years, and that's one of the reasons why early on, hey, Dr. Brandy, thank you so much for being here. I appreciate you. So that's one of the reasons why early on, especially among healthcare providers, you heard us being a little bit hesitant in terms of hearing about a vaccine that was going to be ready in months, because the FDA review and approval process takes usually years. And that's because there are millions of patients that are looked at in terms of what happens when they get the vaccine, what are those side effects, what are some of the longer term side effects that you may not see right away, what happens at 3 months, what happens at 6 months, what happens at 12 months. And so that's something to keep in mind. We won't have that longitudinal data that we would normally have when some of us have to make a decision about this vaccine. Okay, so another thing to realize when they talk about these vaccines being ready, when you hear people say emergency use authorization, when the FDA does that, it's not saying that it's fully approved. They're saying that we are in an emergency situation. We have some data that it might make them feel reassured about approving those vaccines for an emergency use authorization. But for the FDA to fully approve these vaccines, they're going to need to see a lot more data. And that's going to be happening real time. So let's say a vaccine is ready in December. Okay, late December, they start giving out the vaccine to whoever's on this priority list that's being developed by the powers that be. That's all going to be collected as data to go to the FDA for when they eventually review it for full approval. Okay, and so there's going to be no vaccine that's fully FDA approved if you decide to get it as part of the first batch. That FDA approval is probably still going to be a year, maybe more away, depending on how quickly the data comes in. The data, again, usually they need to see. Hey, Michelle, thank you so much for being here. I appreciate you being here. So usually, again, when FDA approves something, it's based on the fact that millions of people have received a vaccine or a drug, and they've been able to study in detail the safety profile. Okay, so that's something to keep in mind. So being that anything that's approved will be approved under an emergency use authorization, it's going to be really important as more data comes out that you consider what the data are. So first, let's talk about the Pfizer one. And this is the one that was announced first mid-April, around November 18th, I believe. And this is the one that they're describing as being about 95% effective. They have already submitted their paperwork for emergency use authorization as of about November 20th. And so emergency use authorization means that the team at the FDA, the teams that are reviewing the information, they usually are going to try to turn around and give feedback in a month or less. And so that's why when you hear them saying, oh, something might be ready by mid-December, they're talking about the fact that Pfizer has already submitted their emergency use authorization application. The vaccine that they've come up with is going to be one that's given in 2 doses, 28 days apart. The Pfizer one is the one, when you hear people talk about storing challenges, this is the one that has to be stored in below freezing temperatures for it to be sustainable and to transport and get to people. They can certainly make millions of doses once they get the green light to go forward from the FDA, but that's the one that is the front runner right now in terms of when something might be available for emergency use authorization. Okay, with that vaccine, as with the other 2 front runners as well, the main side effects that people have described so far are headaches, body aches and chills. It's almost like you have a mild form of the virus that you're trying to fight against. And so that's something that's consistently seen with the three vaccine front runners so far. Now, mind you, I haven't seen the detailed data. What the FDA is going to be looking at is going to be more details in terms of those data. How many people were enrolled? What percentage of those people had mild side effects? Who had really severe side effects? And they'll be looking at all of those things. And let me also say this: an emergency use authorization is not necessarily a given unless, again, those data are really reassuring in terms of the vaccines as they are causing more benefit than harm. So they have a range of different things that they'll look at. And so it's not a guarantee, but based on the fact that it's shown so far to be 95% effective, chances are good that it's going to be at least approved for an emergency use authorization, and they'll continue to look at the data for eventual FDA approval. Let me answer a couple of questions. One question: if you test positive or have the antibodies, should you still get the vaccine? Lee, that's a great question. That's one of the questions they're reviewing, and so far they're saying yes. And that's because the antibodies, people who have had COVID antibodies, it's not looking like those antibodies are in place for long term. And so, we're still studying and understanding whether those antibodies are good for, several weeks, several months. Is not quite clear. But what we do know is that it's not permanent protection. So it's very likely that someone who at some point had a COVID exposure and has mild antibodies may be, definitely part of the group that's recommended for vaccination. We have another question from Valerie. Will those that receive the vaccine in the first round have to agree to be tracked to generate data for the FDA? Very good question, Valerie. I have not seen the consent form, but I can tell you from when I've worked with other emergency use authorization pharmaceuticals when I was at CDC, usually the consent form is very, very detailed. And the consent form usually has things like what you just said, that when you agree to take it, yes, you have to sign off that you're aware that there may be side effects that are not yet known. But and usually one of those things is that you have to agree to be followed up by either the FDA or someone from that pharmaceutical company so that they can have as much data as possible on as many people as possible. And so it's very likely that COVID vaccine consent form is going to request or require that the person allow themselves to be followed up. So yeah, that's a great question. We have to wait and see if let's say if someone were to refuse to do that, it'll be interesting to see whether or not they will still be allowed to be a part of the trial or to receive the vaccine. So great question. Hopefully we'll have some more information about that soon. Lee said, are the vaccines on deck appropriate for children? Great question, Lee. So I have to check that. I think the studies so far, they haven't administered it in huge numbers of people. The studies are between, like high 90s to mid 100s in terms of some of the data that has led to what's in the emergency use authorizations. And I think at least one study they had someone enrolled who was 13 years old, but I'd have to look back at the data to see for sure. Hey, Cheryl, how are you? Thanks for joining. But that's a great question. When they sit down to prioritize which groups are going to be recommended to get the vaccine first, Lee, as they've been talking about all these months, thinking or suggesting that children get milder forms of the disease, etc., my thought process is going to be is that they are probably not going to have children in a high priority group in terms of who gets the vaccine first. That's what I'm thinking. I could be wrong. But I'm thinking that, it might be people who are considered essential workers, people who have pre-existing conditions, to the extent that maybe they've been part of the data set so far. I'm thinking those folks might be top of that list, but I could be wrong. There could be some people who think, it's important for children to have the vaccine so that we can get them safely back in school settings. And so it certainly may be the case that they go that route. So I'm excited and interested because there is going to be, from what I read, a meeting this coming week where some folks from the Biden-Harris transition team and other folks who've been working on the vaccine are going to have some of those discussions about which groups are going to be prioritized. So that's a great question, and I'm hopeful that we will know a little bit more next week. Another question: are there any populations or segments of people they recommend not take the vaccine? Um, Very good question, Lee. They haven't yet said who those people might be, but I would imagine, one of the, and I didn't finish, I'm sorry, talking about the other companies, but Pfizer is the one company who has one of the vaccines already with FDA. Moderna is the other one that has a vaccine. Hey, Patricia, thank you so much for joining. Hey, Teresa, thank you so much for joining. And then the other one is AstraZeneca or Oxford. So, in response to your question, Lee, um, the Oxford study was stopped a few months ago, briefly, when someone had a neurological outcome not, which was of concern in terms of whether or not it was due to the vaccine. I think they determined that it was not due to the vaccine and they resumed the study. But it does beg the question of, if someone has a pre-existing neurological condition, whether or not someone like that would be put into the top priority group, because we still are gathering information and we don't know who might be, or what condition might make someone hypersensitive to the vaccine. So I think when people have certain pre-existing conditions, they may, have groups of people that they don't feel 100% certain yet about administering the vaccine, and that those folks, they might have them wait a little bit longer. So yes, when that information comes out, I promise I will do an update for you guys to talk about what else we've learned in terms of, which groups they're going to prioritize, what dates things might be ready, and also Val's question in terms of what type of tracking might be done by the FDA, so that eventually they have enough data to eventually give full FDA approval to these vaccines. Teresa's question is, so is that why it is safe to send children back to school? Ooh, Teresa, that's a loaded question. Not everyone agreed with children going back to school. But when the discussion was happening, the discussion was certainly tied to the fact that uh, when you look at clinical presentations, clinical manifestations, people having severe sickness, etc., children were a smaller percentage of that group. It's absolutely the case that older persons, 50, 55, 60 and above, were having more severe sicknesses, and certainly are, sadly, the majority of the deaths. And so, there were a lot of factors, some scientific, some political, that went into the decision to send children back to school. And that's also different by state. And so yeah, that's a question that I'm not sure we have the answer to yet, but I know that different states and different jurisdictions are doing different things, and hopefully children are staying as safe as possible. But it's not 100%, because I also know of situations where children have gotten very sick, and children have also sadly been among those who have passed away. So like you, I'm hoping that we get more information and that people can make more decisions that are based on science, and less on political agendas. Hey, Patricia, thank you again for being here. So we talked about Pfizer, 95% effective. Their emergency use authorization has been requested. 2 doses, 28 days apart. Moderna is very similar. It's been found to be 94.5% effective, protecting against COVID-19. Their study was done with about 95% participants in terms of what data went to the FDA. This one they think might be quicker to distribute. It doesn't have the same temperature requirements as the one from Pfizer. And so far, this one, like the Pfizer one, requires 2 doses, 28 days apart. And actually, I think all three of them, from what I've read, have that in common, that for the COVID-19 vaccine, it would require 2 doses, 28 days apart. We talked about another vaccine that was kind of like that. I think when we talked about the shingles vaccine, that one is also 2 doses, about a month apart. So that is probably the mechanism that's going to be used to kind of help the body build up antibodies. Okay. The third one that's a front runner that I'm not sure yet if they've submitted their emergency use authorization request. I know that Pfizer and Moderna have. But the third one is Oxford, the one that's produced by AstraZeneca. Um, the range of effectiveness was from 70%, but in the early part of their study with some patients, they used a lower dose because they were still learning what dose was going to be most effective. When they increased the dose to an appropriate dose, they had a 90% effective rate in terms of preventing COVID 19. They also are two doses, 28 days apart, and their study had about 130 participants, and they enrolled people in United Kingdom, United States, and in Brazil. And so yeah, those are the front runners. Now, the one from Oxford, they're describing as being better tolerated, but again, I haven't seen those data. I'm sure some of the details about what side effects happened and what proportion were affected by the side effects, I'm sure that's part of the data that went to FDA. Hi. Oh, Charlie, thank you so much for being here. I appreciate you, and thank you for your comment. So that's where things are in terms of the current front runners for COVID-19 vaccines. The coming weeks should be very interesting because I think it's going to be really fast moving in terms of information that we hear from the different companies that are involved, that we hear from the FDA in terms of, what information is found to be appropriate for an approval for an emergency use authorization. We'll be hearing about that probably by mid-December. And I think it'll be also fast moving in terms of the Biden COVID-19 transition team. I'm sure they're going to also be looking at data very carefully. Another thing I want to say, because this has come up also when we talk about what's going to happen in populations who are already disproportionately affected. So, and by that I mean, a lot of our Black and brown populations, Black, African American, Hispanic, Latino, Latinx, Native American, those of us who have been disproportionately affected by COVID-19 and who represent a devastating proportion of the number of sicknesses and deaths that have happened for COVID-19. We don't yet know if they're going to be part of the priority group, but what we do know is that there are groups that are on board to be a part of reviewing the data and translating the information in a way that's user friendly and in a way that reassures people that that they if the data shows it, that they don't have to be worried that someone is doing something that's scientifically inappropriate with them. Okay, this country has a long history. We all know that this country has a long history of doing things that were not necessarily in the best interest of Black, Hispanic, or Native American populations when it came to doing scientific studies, testing drugs, doing surgeries without people's consent. And so, there are different groups from National Medical Association to National Black Nurses Associations, different groups involved that are on board in terms of helping to review the data when it comes out, just to really be that extra layer of precaution and safety and a voice so that, as people are talking to our populations, we can make sure that people have the best possible information and the most accurate information so that we can all make informed decisions. There's not going to be anything where anyone is forced to take a vaccine. Yes, of course, there are going to be recommended priority groups to receive the vaccine, but we are not at a space where anyone is going to be forced to take the vaccine. Now, there's one exception to that. I think in terms of those who travel, there are starting to be some countries that are going to, or some countries are having discussions about making the vaccine a requirement for someone to travel to their country. And that's not that unusual. If you think about some of the places, if you've traveled in the last few years, there are some places where you have to have a yellow fever vaccine. Or if you're going to certain countries around the globe, you have to have malaria medication. And so it's actually not that unusual of a thing. But again, I think we're not yet at a place where that's going to be a widespread recommendation by countries. Many countries right now are just requiring that you have a negative test. I have some more questions here. If someone misses getting the second shot, is there a hold period before starting over? That we don't know yet, Lee. It will probably be part of the information that we see coming out with some of the data that's been submitted from to the FDA. I know with other vaccines, that's the case that if you miss after a certain amount of time, you have to start all over again. But I'm not sure yet if that's going to be the case with the three front runners for whom FDA is reviewing the information. It might be if the antibodies don't build up to a certain level, it might be appropriate to start from the first dose again. Teresa said, "Are the vaccines national or global?" You know, national. So every, as you can imagine, Teresa, when this with this pandemic, it's been kind of like all hands on deck. So I've described three companies, but there are way more countries who are working on different vaccines, different companies too, who are working on different vaccines. And so everybody's in a different place in terms of where their vaccine development process is. And so what is found to be effective and recommended for use in the US, whether it's one company or two or more, may be different from what's shown to be effective and recommended for use in the UK or in West Africa or other parts of Europe. And so it will really vary. There's not going to be one company that's supplying the whole globe. So thank you for that question. When a person receives the vaccine, should they be in quarantine during the 28 days between the doses? Um, uh, I'm not aware of that being a requirement. I think I had read something early on where they were looking at that as a possibility. But, again, I'll write that down as one of the questions when we start to get some more information in the coming weeks based on the information that's gone to the FDA. I will look that up to see if that's one of the recommendations that's being made based on the data that they have so far with the vaccine. So great questions, guys. I appreciate that y'all have so many questions and that you guys are interested in this topic. You know, as you can imagine, all of us are trying to get to a place where we get to a different place with this pandemic. It's really taken a toll. We've been dealing with it. Next month will make a full year, and so all of us, I think, are looking for, in addition to our public health measures of washing our hands and using hand sanitizer and using masks and social distancing, we're looking forward to something else that'll give us an added layer of protection. And so, like all of you, I'm going to be looking at the data and the information very carefully. And when there is more information to share, I absolutely will come back on and spend one of our Sunday chats updating about the COVID-19 vaccine, because in reality, it's gonna affect all of us. The information we receive about this vaccine and all of us making a personal decision after looking at all the information about whether or not we're at a space where we're comfortable receiving it. Okay, so I think that was the last question that I see here. I appreciate you guys. Oh, oh, thank you, Dr. Brandy. Yes, it's one of these things. Dr. Brandy said she just appreciated the explanations. And thank you for saying that, Dr. Brandy. It's one of these things that, as I've been getting more questions, I realized that many of us don't necessarily work in this area on a daily basis. And so I think it's helpful for us to keep on having these discussions to make sure that as many questions as possible can get answered, and to make sure that we can all have as much information as possible as more information becomes available. This thing is evolving very quickly, which is a good thing in terms of how information is being shared, but it also means we need to take it in chunks and make sure we understand everything, and that we don't too quickly jump to either deciding not to receive it or to receive it and not have all the information. So again, I thank all of you for being here. If you think of any questions, please feel free to type it in the chat. And as I get more information, I promise I'll come back on and update you guys, or I'll post it on the wall on my Dr. Madeline MD page, if that is a faster way to get the information to you. So we're going to close for today. I am just under 30 minutes, so I try to keep it short for you guys because I know that all of you are busy, and I hope that you continue to enjoy this holiday weekend, whether you're, relaxing at home, chilling, or enjoying time with family, or, or just taking a breather from the day to day. So I am Dr. Madeline, your board certified OBGYN, former CDC epidemiologist, international speaker and published author. I help busy women access tailored GYN care and birth control that they need so that they can have the most freedom and control over their lives and be able to fit in those things that they might normally not have time for. I also enjoy educating the general public about different public health issues and making sure that everyone is as informed as possible so that they can make the best decisions for themselves and for their optimal health. Please, by all means, feel free to follow me on Facebook, Twitter, and Instagram at Dr. Madeline MD. That's DrMadeline MD. And I just want to thank you all again for being here. I so enjoy the time that we have together on this Sunday afternoon. And when it comes to this COVID-19 vaccine, as I get information, I promise I will try to share it with you and be as transparent as possible with everything that's available out there. So thank you again for joining me today. I love you all, and I will see you next Sunday. Okay, bye-bye.